Good afternoon. My name is Willie. I'm a student at MUW, and at this time I will be completing a comprehensive physical assessment. I'm gonna knock prior to entering the patient's room. As I enter the room, I'm gonna perform hand hygiene and don gloves. While I'm donning gloves, I will introduce myself to the patient. Good morning, my name is Willie. I'll be your nurse today. And at this time, I'm going to conduct a head-to-toe assessment. Do I have your authorization to complete that?
Yes.
Okay. Well, let's get started. Can you state your name and birthday for me?
Yes, Jane Marie, February 23, 1984.
Okay, and I'm going to check your armband as well. Okay. All right, Miss Marie. Well, at this time, I'm going to start out by just inspecting your head. I'm going to look at your scalp and see if I notice just any abnormalities such as protrusions, in which I don't know any upon inspection. Now I'm going to palpate, which is lightly touch your scalp. I'm checking for any tender areas. Can you tell me if you feel any pain? Do you feel any pain as I press your scalp?
No.
Okay. Patient denies pain to the scalp at this time, so that lets me know that the scalp is possibly within normal limits. I didn't know any protrusions upon palpation or inspection. Now I'm gonna proceed, and now I'm just gonna look at your face. When I'm looking at your face, I'm checking for symmetry. I see both eyes are symmetric: nose, eyebrows, eyelashes, and lips. All right, let's see. Can you smile for me? All right, good deal. Smile is symmetric. At this time, I will be palpating your temporal pulses. Temporal pulses are even at 2+, non-bounding. All right, and we will proceed to the TMJ, which is the temporal mandibular joints. Can you clench down for me? Good deal, good deal. Now go ahead, open your mouth. All right, good deal, good deal. Do you feel any irritation, any pain? All right, and I noticed that the joints were also smooth. There was no crepitus or hinging in the joints. They moved, the range of motion was perfect. At this time, I will be assessing cranial nerve 5, which will evaluate the strength of your clench. So, once again, clench down. All right, now I'm gonna ask you to move your head to the left and then to the right. All right, now do it again as I apply resistance. Good deal, good deal. All right, I will proceed to the sensory function. Can you close your eyes for me? And let me know when you feel a sensation, okay? All right. The patient did note a sensation on both sides of the face, so that lets me know that her sensory is well intact. Now I will be evaluating your motor function. So I'm gonna ask you to smile, frown, close your eyes very tightly. There you go, good deal, good deal. Now lift your eyebrows for me. All right. And show me your teeth. Puff your cheeks really big. Hey, all right, good deal, good deal. We see now that cranial nerve 7 is well intact, and so we can move on to cranial nerve 2. At this time, I will be assessing your eye function. So, if we can you cover your left eye and read the alphabet?
Okay.
Go down to the furthest line.
Okay. E, K, H, M, C.
All right, now cover your right eye and do the same thing with the left eye.
E, K, G, T, M.
So I noted that the left eye was 20/30 and the right eye is 20/30 as well. Now we'll move on to extra ocular movements. At this time, I will be performing the 6 views of gaze. So if you can look at my finger and follow it as it moves, okay? All right, good deal. Extraocular movements are well intact. She followed my finger perfectly. Now we'll be assessing cranial nerves 3, 4, and 6. And for this, I will obtain my pen light, a handy dandy pen light, if I can find it. All right, now take a look at my finger. All right, I noted that both pupils were reactive to light. They were round and accommodating, and they were equal. Now I'm gonna inspect and palpate the external eye region, and I'm noting anything that protrudes or just seems out of place. I'm also noting symmetry as well. Do you feel any tenderness as I touch around your eyes? Okay. No pain or tenderness is noted upon the external eye assessment. So we'll move on. The eyelashes and eyebrows look to be within normal limits. Take a look at your eyes. Take a look up. All right. Okay. So her sclera, conjunctiva, and her corneas are within normal limits. So the eye assessment is now complete. Now we'll move on to the ear assessment. For this, I will be starting out by just inspecting and looking, not really feeling for anything. I don't want to move anything out of the way if it is anything there. Upon inspection of both ears, I don't note any foreign objects or drainage, no exudate. I do note earrings, which are within normal limits depending on your culture. So now I will palpate the external ear. I'm looking for any tenderness, redness, erythema. Do you feel any pain?
No.
All right. Do you feel any pain on the right ear?
No.
Okay, good deal. At this time, we will perform a whisper test. And I'm gonna cover your left ear. And I want you to repeat what you hear me say, okay?
Dog.
All right. She got that one correct.
Hey.
All right. Hearing appears to be intact as well. So now we'll move on to your nose. I will inspect initially, and I'm looking once again for anything that's out of line. I'm looking for symmetry in the nostrils, no nasal flaring, no foreign bodies within theirs prior to palpating. Okay. And her nose upon inspection is within normal limits. Now we'll palpate. I'm palpating the nasal bridge. I don't notice any protrusions, anything that would indicate a prior surgical history. And so I'm gonna occlude a nostril. All right. All right. Nares are clear bilaterally. And so we will continue to the sinuses. At this time, I'm gonna palpate your frontal sinuses. Do you know any pressure or tenderness? All right. Now we'll move on to the maxillary. Do you feel any pain or tenderness? All right. Patient denies pain or tenderness for both frontal and maxillary sinuses. Now we'll continue, and I will once again don my pen light, and I'm gonna inspect your oral cavity. All right. I note that the gums are pink and moist, the teeth are present, and and her tonsils are intact. The floor of the mouth is pink and moist as well. Her palate is intact. The uvula is moving. So we'll move on to, well, I just covered phonation of the uvula, and so now I'll verbalize, but it did move upon her saying ah. So we continue to the gag reflex. I'm just gonna touch the top of the back of your throat. All right, gag reflex is intact. So now I'm gonna check for symmetry of your tongue. Can you stick your tongue out for me? All right. Tongue is symmetric. It's not protruding to neither side, predominantly. Now we'll palpate for lymph nodes. We will start with the preauricular, and we will move to the postauricular, then to the occipital, and we will continue to the submental, the submandibular, and tonsillar. We will continue down to the superficial cervical, the posterior cervical, and the deep cervical. All right. All right, lymph nodes are noted within normal limits. They aren't swollen or inflamed. So now we'll test cranial nerve 11, in which I will have you touch your chin to your chest. All right, now turn your head to each side. Touch each ear to each shoulder. And extend the head backwards. Now we'll provide resistance as you turn your head. All right. And resistance as you shrug your shoulders. Good deal. Cranial nerve 11 appears to be intact. So at this time I will proceed to the trachea. Can I ask you, raise your head? And with the trachea, I'm just noting that it's center and that there is no protrusion to either side, in which no protrusion is noted. I will also inspect the thyroid initially by palpation. Then I'm just gonna simply ask her to swallow. All right. And the thyroid is not easily palpable, letting me know that it's not enlarged or inflamed at this time. As I continue, I will inspect and palpate carotid pus. So, first I'll just look and see. I don't see any jugular vein distension. And so I will palpate one at a time. Alright, pulse noted at 2+ and good. And 2+ and good. 2+ and good bilaterally with no jugular vein distension present. Now we'll follow inspection and palpation with auscultation of the carotid arteries. I'm going to use the bell. Alright. Upon auscultation, no bruise noted. Per palpation, no thrills noted. So now we'll perform the chest exam. So I'm just gonna look at the posterior chest. Okay. And note that there's no increased work of breathing on initial examination. Now we'll palpate for tactile fremitus and symmetric expansion. So as I palpate, I want you to say 99. Go.
99. 99.
All right. Now I'm gonna percuss over your posterior lobes. Okay. I didn't note any dents or even hollowing, so that let me know that the airways are within normal limits. No fluids are present within the lung field. And so at this time I want to access for flank pain, and let me know if you feel any pain or tenderness, okay? Did you feel any pain?
No.
Okay, good deal. Now we'll auscultate for breath sounds in all 9 lung fields. 1, take a deep breath. 2, take a deep breath. 3, take a deep breath. 4, take a deep breath. 5, take a deep breath. 6, take a deep breath. 7, take a deep breath. 8, take a deep breath. And 9, one more. All right, good deal. Lung sounds are clear bilaterally. So I will proceed by asking you to sit back up. All right. And I will continue by inspecting and palpating your arms. So can you just hold your arms out for me? Okay. You feel any tenderness?
No.
Okay. Okay. Arms appear to be within normal limits. Skin is warm and dry with no diaphoresis noted. No swelling or pain noted as well. So I will continue by palpating the radial, brachial, and ulnar pulses, starting with the brachial on the left arm. 2+ and good. Brachial on the right arm. 2+ and good. radial on the right arm, 2 plus and good, ulnar, and the same for the left, radial and ulnar. And for the sake of time, I'm gonna go ahead and access her pulses and the lower extremities as well. I'm gonna start by accessing the popliteal. They are even, 2 plus bilaterally. The posterior tibia, 2 plus, even. And dorsalis pedis, 2 plus, even. Now we'll access capillary refill. So I'm gonna ask you to hold your hands out. All right. Okay. Capillary refill is less than 3 seconds in all 10 fingers and all 10 toes. So let's check your range of motion. I'm gonna have you flex your arms above your head. Now go behind your back and hyperextend out to the side. All right, now at this time we will perform abduction and adduction. So start with your arms out, bring them close together. There's abduction. Now take them further apart. That's adduction. Now, we will perform passive range of motion with flexion and extension of the elbows. Passive range of motion is assisted. All right, full range of motion is noted in both upper extremities with no limitation of the joints, no discomfort noticed upon movement as well. So now pronate, in which you will hold your hands flat with your palms towards the ground, and supinate with your palm up towards the ceiling. Good deal, good deal. Now flex and extend your elbows against resistance, so that means I'm gonna have to hold on. Push against me. All right. Okay, now pull against me. All right. Flexion and extension intact. Now rotate your wrists in and out. Good deal, good deal. Extend your fingers, flex, extend, hyperextend your wrists like a motorcycle. Good deal. Make a fist, which is already a fist. Now touch your thumb to each finger. Now touch your finger to your nose with the other hand as well. And cerebral function is intact. Now we'll place an object in your hand, but I'm gonna ask you to close your eyes. Hold out your hand. Can you tell me what the object is? Now, I'm gonna write something in the palm of your hand. I want you to interpret that, okay?
8.
Yes. So, neurologic function is well intact as well as sensory. Now I'm gonna check your reflexes for your triceps, your biceps, and your brachial. So I'm gonna put the arm in a dependent position, and I'm gonna strike the tendon, and I'm looking for a response. All right, and we got one. I'm gonna do the same on this side. It was ever so slight, but we got one. Well, that was the tricep reflex, by the way. Now we'll continue to the bicep reflex. And I did elicit a response. And I got a response. We will continue to the ulnar, in which the hand should fly out. Good deal. It contracted. And we got a contraction. So we got responsive reflexes in the upper extremities. For the sake of time, we'll move on to the lower extremity reflexes as well. So I'm gonna ask you to position yourself at the end of the couch. This is the patellar. I'm gonna put the foot in the dependent position, and I'm gonna strike the Achilles. Now, typically, I would want her to sit up with her feet off of the floor, but we do not have the proper equipment for that right now, so. And I'm also gonna access her Babinski reflex by striking the bottom of her foot to elicit a response. She had a negative Babinski response. All right. Okay. Alright, so at this time I will move on to her chest, and I'm just gonna look and inspect the anterior chest wall, looking for rise and fall, still accessing worker breathing as well. And I see that it's within normal limits. I will palpate the precordium. And auscultate all four heart chambers. Initially, this will be performed with the bell or the small side of the stethoscope. And I'm going to start at the aortic. I'm going to move over. Next will be pulmonic. Then tricuspid, and mitral. All right. S2, heart sound noted, which is normal. Negative S3 and S4. No thrills were palpated upon palpation of the precordium. Now we'll auscultate with the diaphragm. Aortic, pulmonic, tricuspid, mitral. Now we'll move down to the abdomen. So place your arms to the side. No abdominal distension noted. Contour is symmetric with no visible peristalsis or pulsations. Umbilicus is intact. No herniation is noted. Now we'll auscultate bowel sounds. So first it was inspection, now it's auscultation. And this is performed with the diaphragm, starting in the right upper quadrant. Now we'll move to the left upper quadrant, left lower quadrant, and right lower quadrant. Bowel sounds are active times 4 quadrants. Now we'll auscultate the aortic and bilateral renal arteries. The aortic will be positioned in the more so the middle, with the renal arteries sitting just outside of those on both sides. All right. Now we'll percuss. All right. And palpate. Starting with a light palpation. Do you feel any tenderness or pain? Any tenderness or pain? Any tenderness or pain? Any tenderness or pain? Followed by a deep palpation. You feel pain? Okay. No pain noted upon palpation of the abdomen in all 4 quadrants. I will continue by accessing for enlargement of the liver. As I move inward, if I note that I can feel it, that would mean that it's enlarged. Here, I do not feel it, and so it lets me know that we do not have any hepatomegaly. So we will continue to the lower extremities. I've already palpated the pulses, and so now we'll continue by palpating for pre-tibial edema, which will be located along the tibia. The right tibia seems to be within normal limits, and the left leg as well. Next, we will perform range of motion with bilateral hip, leg, and knee. So you can raise your leg to a 90-degree angle. All right, and the left leg as well. All right, now bend your knee and touch your chest. All right, with the left leg. All right. Now I want you to rotate your hips. Okay, point your knees in and out. And then abduct and adduct your legs. Take them apart. There you go. Good deal. All right. Noted earlier, patellar, Achilles, and Babinski reflexes were present, with notation of a negative Babinski to the right foot. Now run your heel down your shin on both legs. Now I'm gonna ask you to stand up. Now walk on your heels. All right. Now walk on your toes. Okay. Now close your eyes with your hands down to your side. And it's a slight sway noted on the Romberg, which is within normal limits. At this time, I'm gonna ask you to hop on one leg. All right, and the other. Okay, good deal. and I'm gonna inspect your spine while you're standing. So if you could, turn. And first off, I'm just looking. I don't see any protrusions. Her spine appears to be straight. So no scoliosis noted per inspection. Now we'll palpate. Do you feel any pain?
No.
Okay. Okay. Curvature of the spine is within normal limits. All right. I want to ask you to bend forward. All right. Stand up. Bend to the left side and to the right and backward like the Matrix. Good deal. Good deal. All right. And that completes my assessment for today. Thank you.